Hello, everyone. I'm Dr. Meltem Zeytinoglu. I'm here with you again for our special series for our patients as we navigate these new territories during the COVID pandemic. I'm very pleased and happy to welcome today my colleague, Dr. Tina Drossos. Dr. Drossos is a psychologist, and she is an associate professor at the University of Chicago, as well as the head of our program in health and wellness at the Diabetes Center. Welcome, Dr. Drossos.
Thank you, Dr. Zeytinoglu, for having me on today.
Thank you so much for being here. And so this is really important, you know, in this time where we're asking everyone, including ourselves, to focus on so many things. Wash your hands for 20 seconds at a time, you know, dozens and hundreds of times a day sometimes. For our healthcare colleagues especially, stay 6 feet away from people. Why is it so important that we're asking everyone to focus on this one other sort of health vital sign of mental health right now?
Yeah, so I think especially during a time like this, what we do know, unfortunately, is that mental health problems can worsen and often do worsen during a pandemic like this. There's a lot of reasons why that happens. So for individuals who were already struggling with mental health, sometimes you can experience those mental health symptoms as more severe. But actually, even for individuals who weren't struggling before all of this with mental health issues per se, sometimes during a stressful time like this, mental health problems can peek their little heads through. And so even for those of you who haven't experienced mental health concerns in the past, this could be a time where that starts to happen. And there's a lot of reasons for that, right? So the first is this idea of uncertainty. All of us, I'm sure, are feeling the uncertainty every day. What's today going to be like? What's tomorrow going to be like? Especially what is next week going to be like? And our human nature is, we like the idea of control. So we want to have control of a lot of different things in our lives. And this is something that we really cannot have control over. So when we can't have control over something, that can lead to increase in feelings like fear and anxiety. And that leads to an increase in mental health symptoms. The other reason why sometimes mental health symptoms may worsen or rise during a pandemic, especially one like this, with the idea of isolation and these shelter-in-place orders. So the shelter-in-place orders, of course, are there for our physical protection. So we shelter in place so we don't spread the virus, so we don't catch the virus. But sometimes sheltering in place can increase our feelings of loneliness and kind of feeling like I'm the only one going through this, which of course is not the case. We are all in this together. But when we are in our own place of residence, our home, our shelter, that can make it difficult if we're not seeing a lot of people and interacting. And that can increase our anxiety, especially for those of us who maybe had some anxiety to start with. It can definitely make things a little bit worse. And so if you are somebody that's experiencing mental health symptoms, it can be very difficult for you to also follow your diabetes regimen. So I think that's something really important to be talking about today is when we are so worried, anxious, uncertain, isolated, then we have to do one more thing in our day, which is follow our diabetes regimen. Sometimes that can make it difficult to do. Those feelings can make it difficult to do. Plus, what we also know is that actually when our bodies have increased stress, when we feel an increase in stress, sometimes that can raise our blood glucose also. So we need to be carefully monitoring all of that. So those are some reasons why I think it's really important to be also mindful of mental health concerns at this time.
Absolutely. Thank you so much for that that detailed explanation. I think one of the ways that many people cope is also by eating. You know, people are at home, and not only can they not go out, they may be bored, they may be using that as a coping tool for their stress, and that can certainly affect their blood sugars too. So checking in and reminding ourselves of why we're eating is important. So what are some things that we can do at home to help ourselves feel less stressed and less anxious? What tools do we have?
Yeah. So actually, I'll list a lot of different things that people can do at home. It might seem like there's nothing that we can do and we're just bored at home, but there's actually a lot of different ways that you can work to decrease your anxiety if you're having some anxious feelings. So the first thing you need to do is really think about this idea of control and uncertainty. So we need to sort of find a way, each individual person needs to find a way to make peace with the idea that we do not have control over this. And that's okay. But there are many things that we still have control of, which is our day. What are you going to make of today? How are you going to take control of today for yourself? And by doing that, it's important to think of the idea of structure and routine, because that helps with uncertainty and that helps with control. So people should really have a very structured routine, especially things like mealtime, especially for a diabetes population. As you mentioned, sometimes food can become a coping strategy or a boredom strategy or a distraction strategy. And sometimes maybe that's not such a bad idea, but again, we need to be mindful because we need to be tracking our blood sugars. So staying structured, being in a routine as much as possible is definitely going to help with uncertainty and loss of control. Setting goals for yourself too. Easy goals, simple goals. This is not a time where you set some big, profound life goals for yourself, but what do you want to accomplish today? Especially, a lot of us, when life isn't like this, we're very busy and we've been wanting to do something around the house, clean a closet, organize a dresser, something like that. Try a new recipe. This is the time to do that. Set a goal for yourself every night for the following morning. Tomorrow, this is going to be my schedule. And this is the goal I'm going to set for myself. And try that, I think, will make the day a little bit easier. Hobbies, exploring an area of interest. This is a time to do that. If you wanted to learn how to knit or sew or anything like that. Again, we have to watch our social distancing and our shelter in place order. So we need to take up hobbies that we can do from our home, but there are many, many that you can. And there's a lot of ideas on the internet or ideas of what kinds of things you might want to be doing. Staying active. I do want to talk about this because I think this is really important, especially for our diabetes population and the patients that we serve. Staying active and exercising is going to be really important during a time like this. It's not only important for our physical health, but it is also really important for our mental health. There are tons of exercise videos you can do, and you can get them online. Some of the exercise apps and videos that we used to have to pay for. I think a lot of companies are offering those free of charge during this pandemic, so we can definitely take advantage of that. And pick something that is sort of up your alley and fun. If you're a weights person, then do a weights video. If you're a dance person, then do a Zumba. If you're more of a mindful meditation person, then pick a yoga. Some of them are really short, so you can actually incorporate them. They're like 7 to 10 minutes, so you can incorporate them in your routine. I'm going to wake up to this, and then before dinner, I'm going to do the second part of this exercise or repeat it or something like that. That's really important. I know we're sheltering in place, but getting outside is really critical. A walk is always very nice. Again, you have to be really mindful of social distancing. If you're going to walk and there's somebody walking in front of you, behind you, make sure you're keeping the 6-foot distance. Don't walk in crowded places. But getting outside, getting a breath of fresh air in front of your place of residence, something like that, is also really nice to do. The other thing is relaxation and deep breathing exercises. If you haven't tried those, maybe now is the time. There are tons of links and videos. We are going to have some of these links posted on this page for all of you, some of the free ones, where it teaches you how to do some deep breathing exercises. They're also called diaphragmatic breathing, where you essentially inhale from your mouth, you exhale from your nose, and it teaches you how to do that, and it really gets your body relaxed. There are a lot of relaxation exercises too, where you sort of start from your toes and you work your way all the way up to your forehead and you relax your entire body. And those are nice too. And like I said, there are apps that do that, and so we're going to post some of those for free. You can also find them all over the web. This is also a time where, like I said, anxiety can peak, but it's time to be asking our support network for support. Mm-hmm. Reach out to people. It's a time to really try to stay connected. Mm-hmm. Have a time where you're talking with loved ones and friends, family, whoever that might be. Even individuals you don't usually have opportunities to talk with because life is so hectic. Reach out to those people. Even if you're doing it by telephone, that's great. But if you want to do it via a video chat, like a FaceTime or something like that, that's always really nice too. But just make sure that you're staying connected with people. I think that's really important for obvious reasons of social connectedness. But I think that in a time of sheltering in place and isolating yourself, it's really important to stay connected in that way and realizing that everybody is really in the same boat. Music, books, those are nice distraction strategies. There are a lot of ebooks because obviously we can't go out and get a book at this time, but there's tons of ebooks, music, movies that you wanted to catch up with, a series that people have been talking about that you haven't had the opportunity to watch. Now's the time. A nice bath is a good idea. I want to talk about reading, sort of surfing the internet and reading the new news for the day. I just want to caution people, especially if you're having anxious feelings, about the idea of just getting online or getting on your smartphone and just looking at everything that people are posting. So if you want to read and get information, factual, make sure that it is factual information. So I would encourage you to go to some really reliable sources if you want to be reading up daily. So those are like the National Institutes of Health, which is the NIH website, or the Center for Disease Control and Prevention, which is the CDC. We've been hearing a lot about the CDC, that website. If you want to be reading about mental health problems during this time, again, please make sure you're reading, you're looking and you're reading at reliable sources. So looking at the American Psychological Association, APA, that would be a nice factual site for you so that you're not getting a lot of biased and people's personal stories, because sometimes those can increase our anxiety, and that's the opposite of what we are wanting to do. And I would say that another thing to do, small exercise every day, maybe you wake up to this or maybe you go to bed. If you're having just kind of trouble sleeping, then maybe you do this at night. But kind of look in the mirror and think about 3 positive things in your life right now. And really think about them, be present with those thoughts. Maybe you write them down. And every night or every morning, you can add to the list and just reread them to yourself and just be really thinking about, even during a difficult time like this, there are positives in my life that I can be focusing on.
Thank you so much. That's incredible. And I think a lot of our patients and all of us should sort of write these things down, and I'll kind of highlight some of these wonderful things. I love what you said about structure. I think that's so more important than ever. And for our patients with diabetes especially, that's already both something they have to do, but also always a challenge because of the way that it's so intensive. You have to have structure to check your blood sugar, structure to take your medication, structure in the way that you eat. But, you know, this is a time as we're sort of all being asked to slow down, to maybe this is a sort of an area of hope and a bright light, that this is a good chance for you to build some of that structure that maybe some of our patients were struggling with. To that end, I would also add that adding in this relaxation and these tools to help you cope with anxiety, I would ask that we all structure those into our day, almost make them scheduled. Because, even as someone who's dealt with anxiety, here and before in these difficult moments, one of the things we do is we get stuck in our worry, and we know we need to do these things that help us, but we sort of focus on that. And so adding in, making a schedule and saying, okay, from noon to even just 12:15, I'm going to take a break to do my gratitude, where I'm going to write down what I'm grateful for, or I'm going to take a break to call a friend. I especially love what you said about movement. For a long time, I've been trying to teach our patients that this idea that you kind of have to stop what you're doing and go to the gym for an hour a day, which is wonderful. And I do recommend that when you can do that. But our bodies don't need that. Our bodies appreciate 10 to 15 minutes of exercise throughout the day as well. And our minds certainly can benefit from that as well. So maybe you use this opportunity to connect with a friend and schedule, once a day, a 15 to 30-minute block where you're on a FaceTime with a friend doing activity together if you find it too hard. And that can be as simple as walking in place, pretending you're going on a walk with a friend, marching in place at home. And so building in that structure, I think, is incredibly important. And I really appreciate all those helpful tips you shared for us. And certainly the breathing is something you can access, that takes 10 to 20 seconds in those moments of peak anxiety. And again, we'll have tools for how you can access that. I also want to emphasize, again, a trap I've personally fallen into is, when you are looking at the news, we all have to do that. This information is evolving so rapidly, and especially for our patients with chronic illness, they're looking to see how management of their condition might change. So we all have to be, attuned to the news, but you can easily fall into the trap of 24-hour access and refreshing your phone all the time, and that can certainly heighten anxiety. So if you find that you're getting that way, even by looking at the sources that Dr. Drossos mentioned, then it's really important to even build structure into your news consumption and maybe, schedule so that you're only going to check, 2 times a day, for example, and you have a set time that you'll do that. So thank you for those helpful highlights. So if we're feeling anxious, which a lot of us are, does that mean that we all need to be seeking professional help at this time?
Yeah, so no, not necessarily. One of the things I hope people get from our videos is that we are all experiencing some anxiety. This is stressful for all of us, and it doesn't mean that we need professional help. So it's important first for people to understand that feeling stressed during a time like this, feeling anxious, that's all normal. However, if those feelings of nervousness, of stress, of anxiety are actually getting in the way of your day, getting in the way of the things that you want to accomplish. And what I mean by that is, if you're having appetite changes, either real increase or decrease in appetite, if you're having sleep problems, if you are finding that your worries are keeping you up at night, you can't get to sleep, or you get to sleep and you're waking up very often, you're getting restless sleep, you can't get back to sleep, you're waking up too early, or you're trying to do an email for work, or you're trying to make dinner or lunch and you can't concentrate because your worried thoughts are just keep on creeping up. And if you can't push those thoughts back or really use distraction or good coping skills, and they're just always present and you feel like they're getting in the way of your day, then that might be a time where you want to consider talking to somebody. Also, if sometimes we're not attuned to our own selves, especially during a time like this, listen to what other people are saying around you, friends, family. If they're saying, gosh, you're so irritable, you're so easily annoyed, everything is, this is not like you. Be mindful of that. sometimes negative feelings, anxiety, sadness, depression, those kinds of feelings can make us really irritable and kind of short-tempered, even for those of us that may not be usually. So if other family, friends, support people are commenting on this, on your irritability, that might be also a time to just stop and think to yourself, okay, should I be talking to somebody about this?
Okay, thank you. That's very helpful. So a little bit of self-compassion and recognizing that these unpleasant feelings of anxiety don't necessarily mean that
Right.
something is wrong with you. But I love that idea of also using the people who know you the best to help you. And so, we are so lucky at the university to have you and your team. I always say that I could never practice truly doing chronic diseases without having you guys. So, for our patients who are watching, or generally, what should patients be doing, or what should you be doing if you think that you do meet all those criteria, or some of those criteria that you just mentioned, and that you do need some professional help?
Yeah, and I would say if you're uncertain or if you just want to reach out, please do so. So if you already have a mental health provider, of course, that should be the person that you reach out to. Contact that person. Most people are readily available these days, and just so please reach out. If you are a patient at the University of Chicago in the Kovler Diabetes Center, please reach out to your endocrinologist, and then your endocrinologist will put you in contact with our team, which is our health and wellness team, which is our team that provides psychosocial care. Some of you, we may have already had the pleasure of meeting. Those of you that we have not had the pleasure of meeting, even if you have never talked with us before, we would be happy to talk to you via telephone or video, and just see, get a real assessment of what's going on and what you might need or may not need. And if you're not a patient of ours at the University of Chicago, please reach out to your own endocrinologist if you have one. If you don't, please reach out to another physician, like a primary care doctor or a nurse or somebody like that you have a relationship with that's managing your medical care. And also what you can do is actually reach out to the Illinois Psychological Association. They have a website where you can put in general location, geographic location, insurance, things like that, and you can get some referrals from there as well. But that's what you should probably be doing if you're concerned and want to at least check in to make sure that your mental health needs are being met, and that you don't need any additional services.
Thank you so much. That is very valuable, and I think that this is a session that we'll probably need to repeat, because these tips that you've given us are just, I think, probably, as I said, the next vital sign, the most important things that we should be checking into during this very difficult time. Is there anything else that you want to add for everybody that's listening?
So I just want to go back for 1 minute to what you said about structure and routine. I know I said that that's important, and then you second that, which I completely agree with. And I know you also said sometimes the day gets busy and we kind of forget, and we should schedule these things in. So I really, that phrase really prompted me to be thinking about, you could even use your phone or an alarm or something to plug into your phone. So if you are forgetting to do relaxation or breathing or meditation or yoga, you could use your phone to sort of put alarms on and let it beep. 10 minutes before 12 is my meditation. 2:45, I'm reaching out to a friend. So you can use your phone to kind of help remind you. Sometimes we do get stuck in our days. So you just made me think about that, and I wanted to offer that also as another piece of advice.
Thank you so much. And self-compassion is key here. If you forget one of those alarms, then that's okay. Or if you feel like I'm in a zone, but using Dr. Drossos's advice, you can see there's dozens of things that we can be doing, and this is a really bright spot for us to be doing not only these things that can help reduce our anxiety, but also these are the things things that like she said, these hobbies that you've been wanting to pick up for so long. And so I think those are wonderful tips that I will take myself as well. So thank you so much. Stay healthy and strong yourself. And thank you for all you do for our patients. And we look forward to taking all these tips with us as well.
Thank you. Thank you so much for having me on.